Welcome back to 8 Steps that will help transform lives and your community. My name is Joy Yarber, and I'm your co-host for this empowering training series. In Step 1, Part 2, we'll explore the following. You will gain a better understanding of transformative fundamentals and the different helping systems found in most communities. We'll also examine the tremendous value of distributed transformative networking, and we'll look at the future of funding for most nonprofits. Okay, ready to get started? Here's Mike with more.
Welcome to Step 1, Part 2. As mentioned in our previous session, your key challenge in Step 1 is to make sure that you are well equipped with knowledge and wisdom about issues, challenges, and possibilities that will accompany you on your journey. Your action steps will involve taking time to listen and learn from others who are already engaged in their journey with their community. We can point you in the direction of community stakeholders who welcome opportunity to share their own experiences with you. Our website, collectivecommunityimpact.com, lists many innovative pioneers who are strong advocates for care networking and transformation. Regarding measurable results, you will be encouraged, inspired, and driven to share what you are learning with others in your community. As I mentioned in Part 1, prepare yourself before you position yourself as a public advocate for innovative best practices. Your knowledge and wisdom regarding collective community impact will empower your conversations and ability to cast a clear, concise, and compelling vision for comprehensive, coordinated care. Picking up from where I left off in Part 1, I have learned that transformation is both an organic and intentional process. Some things will naturally happen on their own, while other things require strategic planning and self-motivated actions. A good example is coffee production. Coffee beans, which actually are seeds, are planted and then nurtured for natural growth. But transforming a coffee bean into a cup of coffee requires a lot of processing, including harvesting, drying, milling, and exporting beans to stores. Then there is roasting, grinding, and finally brewing a tasty cup of coffee. All of these processes were carefully accomplished with nurtured care, strategic plans, and collective action. Transformative processes are a way of life for all of us. Some things naturally happen as we grow, from children to adults, but also the way we think and behave can influence transformative processes and our ability to grow in knowledge, understanding, and character. I believe transformative seeds are planted in our life that need to be watered and nurtured over time. These seeds could represent opportunities that we seize or important decisions that we make. These seeds can grow into strong and healthy lifestyles that bear much fruit. I have come to realize that our community, along with its assets, culture, and social capital, can influence how well transformative seeds are watered and nurtured in our lives. This is becoming more apparent to caregivers. Across the country, community stakeholders are realizing that improving people's lives is quite different from transforming people's lives. Community stakeholders tell us that this could be the obvious difference between offering people a hand out or a hand up to a better quality of life and brighter future. Let's now dig deeper into how lives are transformed. Since 2006, we have learned much about ways to successfully help others, which is a compassionate virtue that is deeply embedded into our society's values and culture. Helping others happens in many different ways. By volunteering our time and talents, by offering a helping hand to those who have fallen on hard times, by supporting worthwhile causes that make a difference in people's lives. Helping others can also be as simple as providing words of encouragement to tired souls, paying forward random acts of kindness and generosity, or by offering a warm embrace or gentle smile that brightens up someone's stressful day. Studies show that helping others is good for us as well. In an article in Psychology Today, the author suggested that helping others can make us happier, improve our health and well-being, and lengthen our lives. We are learning that it's not so much about the why, but the how to effectively help others that is being questioned by stakeholders. Helping agencies are now asking some very challenging questions. How do we ensure that our helping is not hurting those in need? Books like Toxic Charity and When Helping Hurts have caused agencies to really think about best practices for helping others. There is a growing concern among stakeholders about the fragmentation that plagues their community with siloed service gaps, isolated impact, and dysfunctional helping systems. Helping agencies are also concerned that their efforts to move the needle on poverty, hunger, and other complex challenges are rarely successful. They want to better understand people's needs and learn how to meet these needs more efficiently, effectively, with real and lasting results. Fortunately, proven and practical solutions are now available that offer helping agencies hope in developing lasting solutions for complex challenges. These can ensure that all helping agencies are better connected, informed, and engaged. Here is an example of the many different helping agencies that are present in most communities. For simplicity, we use the word helping agency throughout this training series to represent any person, organization, or institution that is involved in helping others. Some are charitable nonprofit organizations. Some are social service agencies, which are part of government programs. Churches and food banks can also be helping agencies. Hospitals, schools, and job placement centers can also be considered helping agencies as well. And let us not forget those who support helping agencies like donors, businesses, foundations, and grant providers. All the helping that goes on in a community is often called a social safety net. This represents various programs and services that are designed to catch people who have fallen on hard times. These programs and services are provided by many different helping agencies scattered throughout a community. Some agencies are more widely known, such as the Salvation Army, Department of Social Services, local hospitals, and more. Other agencies are lesser known throughout the whole community, like local churches, neighborhood resource centers, or local charities. We have discovered that some connection does happen between diverse agencies in a formal or informal way. There may be a United Way and its partners. Some communities have a clearinghouse for crisis care. These usually get their support from local churches that do not want to provide direct services, but they offer help with money and volunteers. In my hometown, we have a clearinghouse. It is called the Help Center, which is open a couple days a week. I recently learned that our Help Center, which has been around for over 30 years, just discovered and connected with a large food bank that has also been in our community for about 30 years as well. Surprisingly, the Help Center leadership did not know about the local food bank, which could provide the Help Center with lots of food free of charge. This is a classic example of what we have discovered across the country. Lots of helping others is going on in communities. However, most of it is fragmented, where the right hand does not know what the left hand is doing. We have also discovered that the people, organizations, and institutions that make up a social safety net have overlapping interests and practices. And even though they share common goals, each helping agency has its own unique mission and methods of helping others. These methods are often called a helping system that is empowered by policies and procedures which can be local or regional. The different types of helping systems that are in place in a community include the federal government, which includes the Department of Health and Human Services, HUD, and USDA programs that address food insecurity. The state government, which includes their Department of Social Services or Human Resources, with agencies in most counties. A neighborhood or a community initiative comprised of partnering helping agencies, like the United Way, community development associations, and civic groups that offer programs and services. Also, individual community and faith-based organizations have their own helping systems in place, like a local church, food pantry, or homeless shelter. With so many diverse helping agencies, empowered by so many different helping systems, you would think that helping others throughout a community would be very effective. Well, the answer to this can be yes, but only if there are no wide gaping holes in the community's social safety net. Unfortunately, we have discovered that most community social safety nets across the country need lots of repair to make them strong and effective. Fortunately, care networking technology, which increases communication and cooperation among diverse helping agencies, and an effective referral system can easily strengthen a social safety net, making helping others more effective. When it comes to helping others, agencies are now wondering which is more important, helping others temporarily get by, or do whatever it takes to help them get ahead to a better quality of life and a brighter future. We are encouraged by the helping agencies that are willing to partner with others in developing a streamlined and coordinated approach to holistic care. Let's now take a look at the problems and solutions associated with this challenge. Let's begin by examining helping others through the lenses or everyday perspectives of individuals and families, helping agencies, and community developers. Being able to see things through these different perspectives will be an eye-opening learning experience that you will appreciate. First, let's look at helping others through the lenses of individuals and families, and see what they face when searching for resources that can help transform their lives. Oftentimes, people face big problems when searching for resources. Siloed service gaps throughout a community can leave people stuck and questioning as to where to go for help. This happens when a helping agency reaches its limits in providing help and is unaware of other helping agencies which can provide more help that is needed. A good example is a local church secretary who just had a family with 4 children walk in the door, asking for help. The husband explains that he lost his job last week due to layoffs, and to make matters worse, their house burned out last night due to an electrical fire. All their belongings, including clothes, furniture, and their supplies, were destroyed, and they have nowhere to go. The secretary, who is overwhelmed by their situation, might get the pastor or a benevolence volunteer involved in seeking solutions. But the truth is, the church's charitable resources are very limited. They may be able to provide some money, but it is obvious their limited resources cannot put this family's broken lives back together again. And when the wife asks about other places to go for help, the secretary or pastor might say, "I am sorry, but I'm not sure where you go for additional help." So what's next for this family that's facing extreme hardship? Siloed service gaps are caused by fragmentation and limited service delivery, which plagues most communities across the country. This fosters a dysfunctional helping system, which in turn breaks down efforts to provide an effective referral system in communities. We are amazed that most communities have a large host of helping agencies, each striving to do their part in making a difference. But the reality is that no one or two helping agencies in a community can be all things to all people. Due to a lack of resources, most agencies are limited as to the services they provide and the number of people they can help. These limitations force many agencies to adopt a single focused approach to helping others. Some agencies will specialize in emergency relief, food, clothing, and shelter. Others will specialize in medical services, education, or training. The problem with these specialties is that it can be challenging for people with limited transportation or knowledge about those who can help. People oftentimes must take off work or find a babysitter so that they can travel all over town seeking help from many different helping agencies. It can be frustrating when they realize that an agency's hours of operation have changed or they need an appointment. And it gets very discouraging when a helping agent, after a rigorous application process, informs a client that their agency has run out of resources for the month. Fragmented and limited service delivery leaves wide, gaping holes in a community's social safety net. In most communities, only a small handful of helping agencies, each working separately, are engaged in trying to catch people who have fallen on hard times. They usually are only able to offer a temporary Band-Aid solution to what is most likely a very complex problem or situation. Siloed service gaps make matters worse by prohibiting the creation of an effective referral system that at least offers hope to struggling individuals and families. Without effective referrals, people end up falling through the cracks of a community's dysfunctional helping system. This causes many children, adults, and families to lose hope in finding the resources that will help transform their lives. People in crisis also get discouraged when they encounter lots of red tape when seeking assistance. They often encounter excessive amounts of paperwork, rigid eligibility requirements, and impersonal processes. This discouragement can be repeated over and over again if people have to seek help from different agencies, each with their own policies and procedures. Some would argue that this re-victimizes people who are forced to relive their crisis every time they have to tell their story to another helping agent. And this can be quite embarrassing for people who have a hard time asking for help. A church pastor once told me a story that best illustrates the problem some people have when seeking help from others, especially strangers. The pastor, while looking out his office window one morning, noticed a nice SUV sitting in the church parking lot. He thought it strange that the car had been parked there for about 45 minutes, with a woman sitting in the driver's seat. Wondering if the car was simply broke down, he approached the driver and offered help. The woman said, "I have been out here wrestling with myself as to whether or not I should go inside the church. I know you have emergency food for families, but I'm embarrassed to ask for help. You see, my husband is a firefighter and brings home a decent check each month. But it's still hard to make ends meet. After paying and mailing all our bills this morning, we discovered that we didn't have enough money left over for groceries this week. The woman went on to say, "I know you may be thinking that we made a foolish financial mistake, but the fact remains, we simply don't have food to feed my kids this week." The pastor said, "Don't fret, we will help." The woman was so relieved and very humbled by the pastor's compassion. The pastor told me that he did not realize that a crisis such as food insecurity can happen to anyone, and not just those we label as the poor or less fortunate. Also, bureaucratic policies and procedures can discourage people from seeking help. I once heard a story of one state with over $150 million allocated for social services. However, most of this was not claimed by people in need. Why? Because people facing hardship said, "We would rather struggle on our own rather than go down to the welfare office. It seems that many of the people who work there are very impersonal and look down their nose at us. We don't like it when they stare at us with judgmental eyes and ask so many personal questions, which frankly is none of their business." Siloed service gaps and fragmented service delivery can cause people to fall into a rut, which could be described as a grave with the ends knocked out. The limited assistance that individuals and families get from helping agencies can be perceived as something just meant to help them get by for the moment. The chance to get ahead to a better quality of life and brighter future may seem totally out of people's reach. We are encouraged that helping agencies across the country are learning how to address this challenge. Books like Bridges Out of Poverty and The Power of Collaborative Solutions are paving the way for a better understanding of the consequences of siloed service gaps and fragmented service delivery. Another negative consequence of siloed service gaps is what social workers call the benefits cliff or cliff effect. This happens to low-income individuals and families who are trying to work their way out of poverty but can't find a job that pays a living wage. The problem is that slight increase in a household earnings can cause people to lose their eligibility for supplemental public assistance. This can lead to a net loss in resources, leaving people worse off than when they were getting public assistance. This situation can discourage people and leave them with little or no hope of ever getting ahead. Some may argue, why work at a low-paying job when I am better off staying at home and getting a welfare check from the government? All of what I've shared about siloed service gaps can lead to some conclusions. Fragmented and limited service delivery cannot transform lives and communities. Large-scale social change and transformation will only happen when helping agencies across a community are willing to work together for common good and greater impact. So, a solution for siloed service gaps is simply bridging the gap between helping agencies. This keeps individuals and families from falling through the cracks in a community's social safety net or service delivery system. It provides people with greater access to information, resources, and opportunities that can transform their lives. We are encouraged that communities use care networking tools to bridge siloed service gaps by creating a streamlined and effective referral system. Care networking makes it faster and easier to find and coordinate resources. A process which can take days is now reduced to minutes, all because of real-time information sharing. This reminds me of a remarkable story told to us by Kathy Easley, who is Associate Vice President of Community Impact at Trident United Way in Charleston, South Carolina. Kathy is also the network administrator for our largest care network in the country, which includes 300 organizations and 900 caregivers. A middle-aged woman walked into a church early one morning seeking assistance. She said that all her income came from a small sewing business that she operated out of her home. Much to her surprise this morning, her only sewing machine broke down and could not be fixed. So she was seeking help to buy another sewing machine as soon as possible. She was fearful that a loss of income would impact her family. The church secretary offered some help, but suggested that a bulletin be sent out to other helping agencies in the area, advising them of her need. Within minutes, offers to help came pouring in. The good news was that the woman in crisis that morning was back at work with a new sewing machine by supper time that same day. A well-connected care network, along with a streamlined referral system, is the better way to find and coordinate resources for people in need. Care networking makes it possible for all helping agencies, despite their limitations, to never have to turn people away empty-handed. Caregivers can say with all honesty and assurance, "I may not have exactly what you're looking for, but give me a second and let me check what's available across our community." This means people are better served because helping agencies throughout a community can collectively increase their responsiveness to the needs of individuals and families. They can strengthen their social safety net, making it easier for them to coordinate resources more efficiently and effectively. Our networking tools make it fast and easy for agencies to streamline intake, assessments, and referrals, which keeps individuals and families from falling through the cracks. Agencies can quickly mobilize resources because a process, which oftentimes takes days, is now reduced to minutes. A well-connected care network can provide people with greater access to knowledge, information, and resources from across a whole community. A care network supports agencies' success in providing personal and comprehensive care. Agencies can provide help according to their specialties and then work together with others to coordinate holistic care. A group of helping agencies can now work together with individuals and families in creating a customized transformation roadmap from crisis to sustainability to abundant living. All assistance, referrals, and outcomes can be collectively coordinated, making it possible to monitor forward progress in real time and advise adjustments as needed. I will talk more about the challenges of helping others in Step 1, Part 3.
Hey, thanks, Mike. So where should you begin with these community conversations? A lot of community conversations start out as organic. Think about it from this perspective. If you were in a crisis or emergency situation, where would you go to get assistance or help? Those agencies are the perfect place to start, getting them in the same room, the same place to talk about their challenges and what they see in an emergency or crisis situation. But then also presenting them with the potential solution of being able to work together in a shared data system. The intentional conversations are necessary as well. Think about it as this: those agencies that help a client pass that point of crisis to a place of self-sustainability. Engage those agencies. They can help with counseling, training, education, instruction. These type of agencies, they're necessary to be part of your collaboration if it's to really focus in on true transformation. Our network in Stillwater, Oklahoma is a great example. They sought out this type of formula when they first launched. The community conversations were awesome. There was a tremendous interest from the ability to work together from those agencies. But then it got focused like a laser beam on agencies that also focused on self-sustainability and empowerment past that crisis scenario. Engaging those agencies, those that train, that educate, that's the ultimate way of building a true solution, a true collaboration where everyone has a place, and by working together, it makes for a successful, comprehensive care network that's transformatively focused. In step 1, part 3, we'll look at helping others from the perspective of helping agencies. We'll explore the problems and their solutions for increasing the performance and sustainability of agencies that are on the front line of combating poverty, hunger, and other complex community challenges. For more information about this training series, you can call us at area code 256-764-0633 or email to joey@simonsolutions.com or mike@simonsolutions.com. We're honored that you are watching this training series.